This is a time when almost everything that we hold true and dare is being disrupted. So this is not the time to only look at delivering your programs out with what's happening around you. We have to have that focus on the external and to make sense of what it means for our programs that we're delivering internally and to the people we're serving.
Great, so it is my absolute pleasure to be joined by Professor Kevin Fenton, current President of the Faculty of Public Health and Public Health Director for London. Professor Fenton has worked in a range of executive public health leadership roles across government and academia in the UK and internationally. In his regional director role, Kevin is currently the statutory public health advisor to the Mayor of London and the Greater London Authority. In his role as FPH President, Kevin works across all 4 nations of the UK and with FPH members across the world. Kevin, it's an absolute pleasure to welcome you back to the podcast.
Oh, Kazim, it's great to be here, and I'm looking forward to the conversation today.
Yeah, me too. Thanks so much, Kevin. There's so much to talk about. Let's perhaps start with a bit of a reflection on the What is Public Health campaign that FPH have been leading on, and we've partnered with yourselves on the What is Public Health kind of podcast aspect to the series. It's such a fascinating question to explore. Myself and Josh have had a lot of fun interviewing some big public health leaders on how you would kind of define what public health is. What are your sort of reflections on the campaign and how it's gone, and what you think the kind of broader impact could be?
Well, Kazim, I'm so pleased and proud of the What is Public Health campaign. You'll remember when we started this journey 3 years ago, we were coming out of the pandemic, and there was all this promise that, having gone through the pandemic, everybody knows what public health is. We will be investing in public health, and this is your moment, guys. And it was very clear that as things began to resolve post-pandemic, there is a need for us to be clear, unambiguous, and consistent in talking about public health, who we are, and the difference that we make in society. And that is where the idea of this What is Public Health campaign was born. It was a time for us as the Faculty of Public Health and members to stand in confidence and in our truth about our accomplishments, the value that we bring, and the wider ways in which we are conceptualizing public health in the 21st century. And over the past 3 years, not only have we had the partnership with yourselves on the podcast, we've revamped our website in the Faculty of Public Health. We have created new products or YouTube videos, online resources. We have held a number of conferences, symposia, moments to connect with our members and with others to focus on public health. So it's been fantastic. We're now actually the #1 site on Google. If you type in What is Public Health, it's now the Faculty of Public Health and our assets which show up. And that's amazing, because previously it was the American Public Health Association.
I think many will agree that, over your presidency, you've really, raised the profile of FPH with things like this. And for kind of listeners that aren't aware, you'll be stepping down as president later this month, really, as your 3-year term comes to an end. Just kind of reflecting back on your time as president, we last interviewed you one-to-one back in 2022. You had just come in as president at a really interesting but also challenging time in public health. In the sort of aftermath of COVID-19, public health was in this sort of reflective period as a profession, learning the lessons from a huge pandemic and almost a bit of a kind of trauma in a sort of sense. But also you've had a number of huge challenges over your presidency, whether it's the cost of living crisis, widening inequalities, and also, an increasingly complex political landscape. I guess before we get into sort of detail, what are your sort of broad reflections on your time as president, and what have you learned about your the profession and yourself in a sort of way? Yeah.
Well, I think the first thing that I've learned is a real comfort in my definition of public health, which is the faculty's definition. It's the art and science of improving the health of populations, of tackling inequalities, of prolonging life. But we do this through the collective efforts of society. And I have gone back to that definition time and time again. Why? Because what we've been trying to do and what we've accomplished over the past 3 years is exactly that. We have been resolute on focusing on a few things, a few priority areas that we want to be known for in the faculty, or focus on poverty, climate change, anti-racism, tackling inequalities, prevention, NHS. We have engaged broadly with a range of partners and stakeholders, expanded partnerships throughout with other Royal Colleges, other public health bodies. We have really focused on direct-to-consumer engagement on public health in our What is Public Health campaign. And we've really listened to our members to understand what their needs are now and how do we meet their needs, whether it's in thinking about salaries, terms and conditions, development across their career span, how they connect with each other and how we support each other on our well-being. All of these have helped to shape what the faculty has able to do over the past 3 years, and they fundamentally confirmed to me the importance of the work that we do in public health and why, faced with all of the complexities that you've mentioned, we need a strong workforce, we need an engaged workforce, we need a diverse workforce, we need a workforce that is passionate about what we're doing and focused on our efforts to get things done. So looking back on the 3 years, I think not only am I even more confident in who we are and what we do, but I'm more resolute in ensuring that even as we go through more change and transformation, we're clear and consistent in what we're advocating for and the power of our voice.
And I mean, coming in, you had like a fascinating career prior to coming in as president. Was your time as president what you expected?
I didn't know what to expect, to be honest.
Just saying that, I mean, as someone who's recently CCT'd into a consultant job, some of it is what I expected, some of it is really not. So I wonder what your kind of reflection is. Is it what you expected?
It's so funny because the thing about leadership is you often look at leaders and think, okay, that's a great leadership position, but maybe I'm not ready to stand up to that level just yet. And I remember so clearly just getting on with the various jobs that I'm doing. And I was tapped on the shoulder by one of the previous president and a dear friend and colleague who said, Kevin, you should really think about standing to be the next president of the faculty. And I remember saying to her, I don't think so. That's for somebody else further on in their career. And, so my conceptualization of the leadership of the faculty was completely at odds with what I now know. And I'm so thankful that Maggie encouraged me to put my hat in the ring. As you know, it's an elected process, so anything could have happened. And I'm thankful for members for giving me this opportunity and the privilege of serving over the last 3 years. So how has it been different? It has been way beyond what I could have expected. The support of our members, working with a talented team of colleagues in the faculty staff, being able to not only strengthen how the faculty does its business, but how we're viewed with the Academy of Medical Royal Colleges, with CMOs, public health agencies across the United Kingdom. I've really focused on connecting our members in my membership, so whether through our distinguished lectures, the public health spaces, the conferences, leading and providing visible leadership. Which has always been a sort of natural part of my leadership, but the faculty allowed me and provided a different platform to do it on and to be able to have more authentic and difficult conversations with our members. And even when we went through some difficult times, Kazim, so whether it is the cost of living crisis, responding to international conflicts, thinking about the junior doctors' strike, the dissatisfaction that many of our juniors feel about their training experiences, exams that don't go the right way. There's been a constant drip of things that don't go well that we manage, but there's so many more things that went amazingly well that have really set us apart from other colleges. So when I look back on the 3 years, I feel proud and humbled and ready to pass the baton on, knowing that, I gave it a good try.
Yeah, that's really fascinating. And are there any, one or two kind of highlights? I mean, you've already mentioned kind of a bit about the fair training work, but the climate leadership as well, you've mentioned, and also launching the kind of anti-racism charter as well. What are your kind of one or two sort of highlights from, that's, something that you came in as president and you said to yourself, I really wanted to achieve that? Is there something that was a real highlight for you in terms of impact?
Yeah, so there are many. And the reason why there are many is because when we came in, we very quickly said, okay, we have a strategy for the faculty which goes on until 2025. What we're going to do is to develop board-led focus areas, which are 11 areas and priorities from the faculty where we really want to push hard. And those 11 areas allowed us to have priority focuses in policy, in partnerships, in our well-being for our members, in our global work, etc. And those 11 areas have been the drumbeat for us over the past few years. But to answer your question, the two things that stand out to me. Number one is our collective work on anti-racism and structural discrimination in the faculty. And that's important because it's demonstrated how we take on difficult and challenging issues and are able to create spaces for authentic conversations, meaningful actions, and impactful outcomes. And that's exactly what we're doing now. And the root and branch approach that we've taken, looking at our curriculum, looking at our products, our website, the narrative, our training, we're leading as an organization in terms of embodying anti-racism and ensuring that we are it's more than just what we say, but what we do. The other thing that I'm really excited about is just the areas that we've led on: poverty, climate, and health. We are now known as an organization in taking on some of these difficult societal issues, embedding it on evidence-based practice, and using our skills of convening, of advocacy, of policy development to help to move things forward. So just two areas there which I'm particularly proud of, and for us to be identified as the #1 college when it comes to our sustainability ranking, when it comes to being invited and in the rooms to talk about climate and health, and when it comes to really asking and shining a light on poverty. These are important things for us. But I could have selected 7 more things I'm proud of.
These are huge issues to advocate and have that system leadership role on. Is there anything you wish you could have made more progress on as president?
No. And the reason is that I have to approach leadership with humility. I mean, the faculty job was one of a series of roles that I have, right? So the Public Health Director for London's job is a big job. It runs between different organisations. We've had transformation with OHID. We've had transformation in the NHS. It's just been a busy time. So I think a key part of leadership of any organisation is being humble and pragmatic in realising that you have a limited amount of time to do the best that you can do. And I think I approached the job with intention, with a desire to focus on a few areas to do them well and have that impact, and I achieved those. And for that, I am grateful. So I'm not looking back with any regret. I know, though, that there's more work to be done, and that's part of handing over the baton to Tracy and Zafar when they start. And that process has started. This leadership is like a relay, and your one job is to being Jamaican British, being Usain Bolt on that final leg, on that penultimate leg, and just doing a really good job of your leg and handing that baton on. And that's what I think I've done. And that's what I think I've done well and that I'm proud of. And I've done that because of the support of our membership.
Yeah, I mean, speaking of that baton analogy, we've got the wonderful Professor Tracy Descavage coming in as the next president. If you were hypothetically to kind of leave a note in the hypothetical drawer of the FPH president, what's the message you would leave for the next president?
You are not alone. That this is a shared endeavor. And as president, there are times when it will feel that you have the weight of the 6,000 members on your shoulders and having to make tough calls. But always remember that you're not alone. You're supported by a great staff, a great board, and most importantly, you're going to have past presidents like myself and Maggie Ray, who are there on the wings, wishing you and sending you all the best wishes for your presidency.
Yeah, I love that message. That you're never alone, and you've always got that network of people to lean on. One of the things that when we last spoke at the beginning of your presidency on the kind of subject of leadership, I find it really fascinating that you through your presidency, you've gone through a lot of different challenges, and even particularly now when it comes to the restructuring of healthcare in the UK, cuts to global health funding, polarization of society, costs of living, climate health. arguably we are living in more complex times, more political issues are affecting health in so many different ways. And you wrote in a recent blog article for FPH about the need for public health leaders to evolve. So you wrote, we must evolve to embrace the intricate and interconnected realities of our times. What did you sort of mean by this, and what do you think we need to change when it comes to the kind of paradigm of leadership in public health?
One of the things I've been really drawn into in my own practice is the butterfly effect. That the butterfly flapping halfway around the world will have a consequence for what's happening in our time here and space. In other words, small and inconsequential actions, whether in policy or in one part of the world, will eventually somehow be connected to us, because ultimately we are connected. And recognizing that interconnectedness allows us to not only focus on the here and now, what's in front of us, but it behooves us to begin thinking about and understanding the context within which we're working in, to make sense of a rapidly changing environment, to understand what's in our control and what's not in our control in this rapidly changing environment, and then to make the best decisions we can on the day with the resources that we have to make a difference. My call to the faculty and to members is, yes, do a great job with what you're supposed to do in your organization, in your role, but always look horizontally, look out to understand context, because context really matters. And this context matters in a highly connected world, in a world that's changing really rapidly, and in a world where there's uncertainty. Because nobody would have thought at the beginning of the year that we would be faced with a massive upheaval in the global social order, the global order, that we would have seen global health programs being disrupted in the way we have, that we're seeing misinformation and disinformation on steroids, which are affecting the pillars of what we thought we knew in public health practice: the importance of vaccination, the safety of drugs, the importance of delivering these life-saving services, including fluoridation of water. This is a time when almost everything that we hold true and dare is being disrupted. So this is not the time to only look at delivering your programs out with what's happening around you. We have to have that focus on the external and to make sense of what it means for our programs that we're delivering internally and to the people we're serving. And that's the call that I'd like to see, because to manage that needs some new skills, right?
Yeah.
We need to be able to begin better at not only looking at the evidence, speaking to the evidence and advocating on the evidence. We need to be understanding how the evidence is evolving and changing. We need to understand how people are communicating and understanding science. We need to be able to draw upon other partners, recognizing that actually sometimes not being the only one in the room to call for an action or to advocate for change is going to be helpful. But your ability to build coalitions in this increasingly complex world is going to become increasingly important. And then finally, being agile, right? Reframing all of these changes that we're seeing. Remember, the NHS used to change every 7 to 10 years. Now it's changing every 3 years. It may begin to change every 2 years. We have to reframe how we view change, and therefore the resilience and the skills we need to adapt to that change. So those are some of the things that I'm seeing in terms of how we have to evolve. It doesn't take away who we are essentially as public health practitioners, but if we are prepared for the world that we're going to be working in, the world that we find ourselves now, we're going to be better able to take full advantage of some of these.
Yeah, no, I like that. The kind of reframing and understanding expectations and the wider context of what affects public health. I think that's really important advice. I mean, on the kind of political aspects of public health, I think most would kind of agree that public health is inherently political as a profession, and there are indeed, political determinants of health. And one of the things that a number of registrars are very much interested in is the FPH role in that system when it comes to advocacy. So FPH is the kind of authoritative body for advocacy on matters of public health. And part of its role, as has been written many, many times, is to kind of speak truth to power. So speaking truth to government, for example. You've had some really hot political topics cross your desk as president, as a kind of understatement, whether it's, public health grant allocations, net zero, as well as numerous conflicts and humanitarian crises, whether that be Gaza, Sudan, or Ukraine. What's the kind of behind the scenes approach that you take to these topics? I mean, I've heard a number of former CMOs and public health leaders speak about this idea of building trust and political capital and using your influence wisely in situations. What's your kind of approach to when do you push on an issue, when do you not push on an issue, when do you take advantage of the kind of the waves of opportunity in public health?
So there are a few things here to reflect on. So the first is public health is political, but we are not politicians. Public health practitioners are not politicians. And that's an important distinction to make, because there are often times when people have wanted us to get into political spaces and to have political debates, which is not what we're about. The second reflection is that everything we do in the faculty goes back to our charitable objectives. So we're not going to stray away from what we have been set up to do. And that means that the boundaries of what we can do in terms of advocacy are absolutely clear. It's in our objects, and we operate towards that. Third, there is a tendency in public health for people to want to comment on everything. The challenge, of course, is that your voice and your brand is incredibly important when running an organization such as the faculty. It takes a long time to build trust and to have a trusted brand, and we have seen how that can be lost very quickly. And so understanding how you use your advocacy voice, when you use it, and what you prioritize it on is critically important. Now, the faculty under my leadership was absolutely clear. We said there are 5 things that we want to be known for over the last 3 years: poverty, climate change, inequalities, the work on the NHS and prevention, and helping people to live longer and healthier. So really looking at a health improvement. And within those 5 priority areas, we've been able to focus on different ways of advocating, right? So for some, we've been writing to the public health minister to highlight issues related to poverty. We've been writing to the NHS recently on the NHS changes and how you should be ensuring that there's great public health advice in there. For others, we have held conferences to build the science together. For others, we have been writing in the published literature and talking about and using those platforms for advocacy. So we have a variety of tools that we can use against those priorities. Finally, over the 3-year period, no matter how well you plan and you have your priorities, there are going to be things coming from left field which requires us to respond as a faculty. And there's a process for doing that. And that process has 3 steps. First, as a leader and as the board, we assess the situation and determine how important it is for us as a faculty to comment on this or to be seen to comment on this. Is it aligned to our objects? Is it one of our priorities, or is this really extraordinary and we need to be in this space? Number 2, is this best done by ourselves as a faculty or in partnership with others? Should we call ADPH, the Royal Society, other medical colleges, so that we have a collective voice on this? And number 3, what is the advocacy position we're taking? And that's really critical, because again, we go back to the evidence, we look at what we've said in the past, we think about what is the most meaningful comment to make, and then we understand what channel to use and how to land it. And I'm spending a little bit of time on the process of advocacy in the faculty, because I want members to understand that this isn't an off-the-cuff remark by myself to The Guardian or to The Times. It's a deeper process, it's a more intentional process, and it's a process that once we make a statement and a statement is logged, that becomes part of our voice, which is then built upon in subsequent communications. So that intentionality and that approach to advocacy, number 1, keeps us safe. Number 2, ensures that we're internally consistent with what we're saying. But number three, it allows us to be both strategic with long-term advocacy, but also responsive when we need to be. And I think we've tightened that process up in the faculty. It's a much better oil machine now. And we now are looking at a lot more environmental scanning and saying not only what's coming out left field, but what are we predicting will be coming up, and how do we respond to that as well?
Yeah, I see what you're saying about the sort of long-term approach of FPH being very intentional with what it says and when, in order for it to have more impacts. I think you've sort of answered a bit of this already, but to me, how are you sort of squaring, I mean, your sort of, your own personal politics, FPH as an organisation and that long-term thinking, but then you've also got, you know, the FPH members as well, who I know are very, very vocal sometimes. How are you squaring those three things? That seems like a really tough position to be in.
Yeah, that's a challenge of leadership, right? So as president of the faculty, my own beliefs and policies and politics would never be brought to the table. The great thing is that because we've set up so many ways in which we're engaging with members, we're constantly listening and hearing from our members, or special interest groups, or subcommittees, the places, the public health spaces, forums that we've set up, all of the lectures. We're constantly in listening mode. Our local board members are working with our members in place. They're constantly saying, Kevin, this is what we're hearing. In our board meetings, we're always hearing from what members want, what are important to members, and reflecting on what we're doing. So that process of evidence gathering, of active listening, of social listening in public health is critical. Now, I'll be picking up things in my day job, but so will others. We'll have spaces as officers working with the staff to say, this is emerging, we should probably be thinking about this, and then that gets into the discussions that we have. So what I learned about the faculty, and maybe this is what I think all of us don't know when you're outside of the faculty, it's like all organizations, it's organic, it's dynamic, it's changing and evolving, because it's constantly looking at the external environment and saying, actually, what do we need to do for our members so we position our members best for this issue?
Yeah. No, thanks for your honest answer on that. I mean, that's a tough position to be in. Great. So moving a bit on, I think you've already mentioned a bit about this, about the age that we're in with social media and health misinformation. And I know social media and communications is definitely one of your passions, and you've really continued this in your term, you know, with FPH having a very strong presence on social media, as well as their new website being launched in your presidency. You're one of the very few public health leaders who I've seen active on multiple platforms, taking a specific approach on different platforms. What's your approach to social media? Why do you think it's important? And do you think more public health professionals need to be on social media?
So I believe that if you're in the business of public health, you have to be in the business of understanding the public, listening to the public, and engaging with the public. And so if the public is changing the way they trust people in government, how they trust people who they see to be establishment figures, if the public are getting their information in new ways or are having conversations about matters related to their health well-being in different ways, then it behooves us as public health people to understand this, because this is our core business. You know, you wouldn't have a cardiologist dealing with hearts and then not being interested in a drug that may have an impact on the heart or an activity that may have a negative impact on the heart. So I think it behooves us to understand the public, all right? So for me, social media has been a natural way of not just communicating and getting information out, but to do some of that social listening, to understand how people are processing information, but more importantly, to evolve how I speak and how I engage with the public to get my messages across. And you see the importance of this because we've just come out of the pandemic, where the need for trusted, diverse, and credible voices on public health was seen as a critical aspect of what would help to motivate behavior change, what would help with compliance of guidance from COVID, and what would enable people to do things from take a test, get vaccinated, or to contact trace their partners. So the power of your voice, the clarity of your voice, and the trustworthiness of your voice is important. Now, technology is moving really quickly, and there's a real danger that all of us will get left behind. So the other objective I have with social media is to ensure that I'm constantly looking at and learning new technologies and putting myself in the space of understanding those new technologies and how to apply them. And you're right, my voice on X is very different to my voice on Blue Sky, which is very different to my LinkedIn voice, which is now very different to my TikTok and my Instagram voices. Because I'm able to, at an authentic level, it's still Kevin speaking, but it's Kevin through a different lens. And that hopefully allows people to see different sides of me as a leader, which is a critical part of authenticity, right? So you will see creative Kevin on Instagram in a way that I didn't allow people to see for the first 3 decades of my career. But you'll see the much more reflective, oh, this is interesting from a technical perspective on X. Let me share it with my followers. And on LinkedIn, it is much more about, here's what I'm doing as a professional, here's how I'm connecting, here's what my thoughts are in terms of our field and so forth. But together, that gives a sense of, and using those platforms in a way both to master the platforms, but to use them for a wider good, because I'm speaking to different audiences as well. Does that make sense?
Yeah, that doesn't make a lot of sense. But I mean, why do you think there aren't many public health leaders on these platforms? I mean, there are so many. I mean, just in my own, space in health protection, most consultants and beyond that, they just like doing their work and they've got their own space. They don't really see the need to engage on these platforms, or perhaps find it challenging to put themselves out there, because it is a challenge. I mean, if you look back to COVID-19, the increase in awareness of these public health personalities, whether it's Chris Whitty or Jonathan Van Tam or Jenny Harries, there's also a bit of a dark side to that as well, of putting yourself out there. How do you think public health leaders can be more involved in that? Do you think more public health leaders need to be on there?
I don't think necessarily more people need to be on there, and in fact, maybe it's a good thing. So I've cornered the market, which isn't a bad thing. But clearly, it would be nice to see more people who are trained and who are developing the skills as well. I mean, we have AI here, and I'm now doing really interesting work in understanding how you use AI to both to be used as an opportunity to disseminate information, to process information, to think about how people are using it and applying it to public health practice. So there will always be the dark side, and I have my rules for engagement on social media. So, if you're rude, if you're disrespectful, then there are ways of dealing with that very quickly, because I'm not going to be on a platform where I'm going to facilitate bad behavior. But second, I am not the kind of public health person on social media who gets into back and forth debates. I'm not going on social media to debate. I'm going to share information. I'm creating communities of practice and of learning, and I'm hoping to inspire and empower people who are following me. This is not to scrap and to fight. This is about creating a safe space online. And if you're going to be doing it, bear in mind that I've been doing this now for nearly 15 years. My first Twitter profile was in the 2000s. And over time, I've been building up and developing deeper competences in all of this. And so many people won't want to invest the time in doing this. And maybe that's why you're not seeing more people. But what I would say to anybody who's interested in doing it, be clear about the why you want to do it. Be clear about the rules that you set for yourself and how you want to engage in the public. Make sure that your organization and your organization policies allow you to do it, and make sure you have the clearance to do it. And then finally, be mindful of curating your voice on social media. Be careful about what you say, how you interact, your brand on social media, because it does translate outside of social media as well, and you need to be really careful about that.
Yeah, that's really, really fascinating. And it's really fascinating to see, the different approaches on your different social media platforms. I mean, certainly your Instagram, I think 10, 15 years ago, as someone coming into public health, would have found your Instagram really, really useful and inspiring of what are the skills you need to get into public health? What does the day in a life of a public health leader look like? So I definitely recommend people to follow you on Instagram in particular. Great. So we had a lot of questions sent in from registrars, obviously, as you're leaving as president. And they were actually really enthusiastic to learn more about you and the kind of person behind the scenes. Let's start with a bit of an interesting one about failure, perhaps a subject we don't necessarily talk about enough as a profession. I don't know if you've read any Brené Brown, but this question feels like it's come from a Brené Brown fan. What has been your biggest professional failure, and how did you recover from it?
So I fail all the time because I'm always pushing and I'm moving fast. I'm trying new things, and things sometimes don't work out. I've failed when I've applied for jobs and didn't get them, and I thought at the time they were the best job and this is the one I really want, and I didn't get it, and I know why I didn't get the jobs, and I'm glad I didn't get the jobs because it wasn't the right time and it was the wrong job for me. I have tried with really innovative programs sometimes which didn't get funded or didn't get taken forward. I've applied for many research grants and wasn't successful and had to regroup. So failure is just part of this, right? But what I've learned is not to take it personally. I'm moving fast, I'm innovating. I'm not breaking things, but I'm trying things, and I'm bringing partners with me, doing things together. And when it sticks, we move fast and we have breakthroughs. And when we don't spend time sort of crying over spilt milk because we're constantly innovating. Yeah. So hopefully that helps. Yeah. Failure is just part of, in fact, it's so ingrained in what I do now because it's contained failure, because I had experimented, it didn't work, we move on.
Yeah, get up and try again. Yeah, exactly. No, I like that. I like that approach. As I said, we had so many questions from registrars, so perhaps let's end the episode with a bit of a quick fire round, quick questions. Number one, what do you do to de-stress?
I go to the gym 3 or 4 times a week. I go to the park. I love spending time in green spaces, and I live close to the river. And let me tell you, there's nothing nicer than just being on the Thames on a summer's evening. Nature and exercise. Yeah. Yep.
One leadership trait that you wish you had.
I wish I didn't care as much about what people think about me. Okay. I'm getting better at it as I've gotten older. I'm more confident in myself. But I think as a black male navigating this world and this space, I think for many years, I was really sort of paralyzed by, is this going to be it? And no, I've let go of a lot of that. So I wish I had that confidence a lot earlier in my career, and I wonder what that would have done to my trajectory.
Yeah, I mean, you sort of mentioned this at the UK Today conference about you've developed this comfort with age. Do you think it was just a time thing, or is it something that you've really worked on?
I think I've worked on it. I think it's time as well. I think as I've become more competent, more confident as a practitioner, it allows me to occupy a space of just, this is who I am, this is what I do, I know what I'm good at, I know what I'm not good at, and that's okay.
Yeah. Next one. So the most important public health skill today?
Your ability to communicate and engage. Yeah.
Who is your public health hero?
I'll go back to my first mentor, who is somebody who I still love dearly, and that's Professor Ann Johnson, who is an epidemiologist at UCL, who was one of the chief investigators of the National Sex Survey in Britain. I had a chance of training under her, working with her on the second British National Sex Survey as one of the investigators there, and she's really shaped, gave me my first job in public health and has been there alongside me.
What was it about her that really stood out to you?
She is just a wonderful human being, a great epidemiologist, somebody who taught me how to, she probably pinch me for this. She taught me about how you manage and plan your career in a strategic way as an academic, being involved in policy, thinking about implementation and impact, but also how to mentor others and to bring others along with you. And I saw her managing all of this, and her legacy as an epidemiologist is just phenomenal. And so I feel privileged to have been trained by her and to call her a friend all these years.
Public health's biggest win in the last 2 decades?
I am going to say a reduction in smoking, which is having a huge impact on cardiovascular disease and having respiratory diseases, children's health. And I don't think we've reached the end of what's possible with reducing levels of smoking. So I'd like to say that as one of our bigger accomplishments. Yeah.
What is your favorite part of your job?
The diversity of the topics that I'm able to be involved with, the people who I'm able to work with, and the fact that every day is a new day and to make some difference somewhere in the portfolio. That's such a gift. Yeah.
Amazing. That's all the questions from the registrars who sent in all their questions. All that's left to say is a big thank you, Kevin, on behalf of the podcast. It's been an absolute pleasure to interview you and work with FPH on the What is Public Health series, and we'll be keenly looking to the future of what you do. And thank you so much for engaging with the podcast. You've been an amazing support to us, and thank you for joining us. It's been great to speak to you, Kevin.
Wonderful. Well, listen, thank you so much. The partnership has been phenomenal, and your podcasts have been great. I've really enjoyed listening to them as well. And I look forward to seeing what you guys will do next.
Thanks so much, Kevin.